The CombiCarrier II has been designed for use in extrication of patients while assisting in maintaining immobilization. The CombiCarrier II is a sturdy piece of equipment weighing 7.1 kilograms with a load capacity of 205 kilograms. The CombiCarrier II is a versatile piece of equipment and can be used in situations such as road traffic crashes. We will now demonstrate the application of the CombiCarrier II. Lay the CombiCarrier II down next to the patient, aligning the top of the carrier to the patient's head. Now there are two latch lever tabs that allow the carrier to be separated into two pieces. Pull back on the latch lever tabs at the top and bottom of the carrier to separate the carrier, and then move one half of the carrier, the half closest to the patient, to the opposite side of the patient. Now one officer must support the patient's head, providing C-spine immobilization when required, while other personnel, when required, assist in the manual handling of the patient as per QAS CPPs. Now slide one half of the carrier underneath the patient. You will need assistance to gently lift the patient's shoulders and hips to slide the carrier section under smoothly. Once the first carrier section is in place, slide the other carrier section under the patient and secure both the top and bottom latch assemblies. Now always check that the latch lever tabs are secure so you are certain that the carrier isn't going to separate whilst the patient is lifted. Now use the provided straps to secure the patient to the carrier. The straps are attached via holes along each of the ends and on the sides of the carrier. Now, as the patient here is to be carried only a relatively short distance and across flat terrain, a foot strap has not been applied. 4 straps have been utilized to secure the patient. 2 straps crisscrossing the chest, 1 across the upper thigh, and 1 just above the knee. Additional straps supplied with the CombiCarrier may be used if required. Always ensure, however, that the positioning of the straps does not interfere with the injury. Tension the straps sufficiently to secure the patient. Once the patient is secure, it is safe to lift the carrier and relocate the patient to the stretcher. For increased stabilization, slide a blanket under the patient's head. Now roll each side of the blanket and position each roll snugly beside the patient's head, and use tape to secure the blanket rolls if required. To secure the patient to the carrier in non-horizontal alignments, such as extrication down a set of stairs or over sloping terrain, it is recommended that 5 straps are utilized and configured as shown here, with 1 strap securing the feet. The application of a foot strap will prohibit the patient slipping down the carrier. Now the officer and/or bystander at the foot of the carrier must closely monitor the positioning of the foot strap to ensure that there is no danger of the strap slipping off the feet. The straps provided with the CombiCarrier are sufficiently long enough to secure the feet of a tall patient whose feet may extend well beyond the bottom of the carrier. Now feet extending significantly past the bottom of the carrier creates somewhat of an obstacle, and that the officer and/or bystander positioned at the foot of the carrier is forced to adopt an unsafe lifting and carrying posture. In such situations, it is recommended that 2 officers and/or bystanders lift and carry the bottom of the carrier via the side handles rather than the end handles. Now the maneuver shown here demonstrates that this is a very workable option through even narrow interior spaces.